Doctors of Reddit, do you ever find yourselves googling symptoms, like the rest of us? How accurate are most sites' diagnoses? I've worked into emergency departments and doctors have no shame in googling something they don't know. It really saves them from making an error and allows them to continuously learn different things. In the air you see so many different things and are bound to come across cases so unique that you hardly have any background knowledge. Anything Google usually comes from a reliable medical journal and docs generally cross-reference to verify information. We definitely do. We use Google, Wikipedia and lots of free and subscription apps to find what we're looking for. The difference is that we know A, how to word our search to find what we need, and B, how to filter the crap and pseudoscientific results out. It makes a big difference when you search for, say, allodynia and edema and blanching erythema rather than painful swollen and red, or can interpret articles and studies with a critical eye for their use of statistics. That is, looking for absolute rather than relative risk reduction. Power of the study, inclusion-exclusion criteria, number needed to treat, efficacy versus effectiveness, etc. That's all stuff you learn in medical school. Then as you progress through practice you get better at pattern recognition. Medical education is as much about learning how to learn as it is about what you learn in school. TLDR, yes. I think a lot of college education is learning how to learn. I think it's important to note that when a doctor Googles your symptoms, they use their education to filter out false positives that a layperson might not, and B, don't have an agenda, meaning, they're looking at the results objectively, whereas I might downplay or overemphasize certain symptoms when Googling my own condition because I have a deeper emotional stake in the outcome. In other words, please don't think that, because medical professionals use the internet to research your conditions, you can justify cutting them out of the equation. Also, it's lupus. I went to the doctor last month, and she was like, I'm going to be honest, I'm not totally sure, but what I can say is it's not life-threatening or serious at all. I'm going to ask my colleague quickly for her advice, and then after you leave today I'm going to Google it, look around, and call you next week to tell you what I found. To tell you the truth, these are the signs of a good doctor. They definitely do, and very often. Usually they know which things are reliable and how to search based on their medical knowledge. If you go to the right site's journals, and you know which symptoms to type in, and how to accurately determine if you really have those symptoms, then it can be very accurate. You also have to know how to discard inaccurate results. If it gives you a rare blood disease only found in Africa, and you have never left Kentucky, you probably don't have it. Source: wife is a doctor. Yep, I've had a surgeon Google something before while I was sitting in the office with him. He just wanted to make sure the weird symptom I had was in line with what he thought it was. Sometimes the websites list really rare things that doctors forget can happen. I'm a doctor and I have no problem checking my computer to look something up. Usually it is a website hospital pays for called UpToDate, which also has a medication interaction program you can plug meds into to make sure they don't kill the patient. Wheeless Orthopedics is pretty legit for musculoskeletal stuff. When patients bring in stuff from there it's pretty accurate. Side note, when I'm in a room with a patient and I tell them I'm going to look at thyroid MRI or X-ray on my computer in my office because I have a better monitor, it's because I have to take a pee. I've always wondered if when they say that it's to do something else. I always replay the conversation to see if they're stepping out to laugh at something I said. Doctors, especially specialty trainees, do a lot of Googling. There are so many rare, weird and wacky conditions out there that no one can possibly know everything. I've spent the past 2 months on a pediatrics team, and at one time we had a kid with an incredibly rare congenital syndrome. Heart on the wrong side, liver in the middle, multiple non-functioning spleens. Thankfully we didn't actually have to manage his chronic issues because they were being managed by specialists in another city, but only one of the senior specialists at our hospital even knew what it was. The registrars, residents and medical students did a lot of Googling, because that's how we learn. With acute management you will find that guidelines are constantly evolving. The algorithm for dealing with a patient with a prolonged fit of epilepsy that you might have memorized a few years has probably changed 2 or 3 times since then. Midas, phenytoin, BTW. There's no shame in doing a quick Google to find the most recent guidelines. It's far better to treat your patients safely and with confidence than to try to do something you're not comfortable with off the top of your head. The emergency department is probably the part of the hospital where Google and other online resources are most used. Presentations to ED are extremely diverse, with no two shifts seeing the same case mix. If a quick Google can save a call to the consultant at 3 AM and still allow you to treat the patient safely and effectively, then that's what most doctors are going to do. Google is an incredibly powerful tool in the right hands, but only if you know how to use it. In medical school we are taught skills to effectively search the volumes of information online to pick out what is relevant and discard what is not. A site like WebMD may tell you that you have cancer, based on your non-specific fatigue and weight loss. And sure, there may be a chance a doctor would take into consideration your presenting complaint, your medical history and any investigations that might be done to work out a diagnosis. Aside from Google, we tend to use clinical practice guidelines, local health system, ETG, ETC, clinical decision support making tools, up-to-date, BMJ best practice, Medscape, review journal articles and more. I do it all the time. Part of what hasn't been touched on so much is knowing what information is pertinent about the patient's symptoms. Most people who come in with a problem will have a handful of generalized symptoms that don't tell you a whole lot by themselves, but there will often be one particular symptom that is extremely important that helps guide your answer. Knowing what the important thing to zero in on is where the education and experience comes in. My doctor once talked me through what she could find about my symptoms on Google. It was a little surreal at first, but she explained how there are reputable medical journals out there and their search functions are rubbish and going through each one would take a long time. So they use Google fairly frequently when diagnosing and treating patients. I've seen anesthesiologists Google things in the OR and I've seen surgeons have people Google info for them in the middle of cases. There is no shame in double checking and getting it right rather than fricking up. I usually don't Google, but I use the internet and medical searches frequently. I don't know everything and I don't pretend to know everything. There is so much out there and it's always changing. It's impossible to stay on top of everything 100% of the time. I go to courses and conferences but they still can't cover everything. I have no problem saying to a patient, listen, I haven't heard that before and what you're describing is pretty unusual. I don't know what's causing it. Let me research it a little bit. Check some tests and see what we can figure out. Some people are very happy with that. Some people get very pissy and adopt this attitude like, how could you not know why I bleed from my elbow when I fart after eating asparagus on the third Wednesday of the month? I have always adopted the attitude that being straightforward and honest with your patients is the best way to be. You want to find a different doctor because I didn't know some obscure bit of minutiae? Go for it. I'll be busy working hard to help the patients I do have. When I first presented with symptoms of MS 12 years ago, I went to the ER because I didn't know what the frick was wrong with me. The first doctor diagnosed it as a panic attack and I was in a Xanax coma for a week before I decided I wanted a second opinion. The second doctor asked me what I thought it was, and I told him I had been researching my symptoms and MS seemed to fit. He excused himself for a minute, did some googling, and referred me to a neurologist because he agreed that my symptoms were in line with early onset MS. I'd say they use any and all available resources if they don't have an answer, and internet searches are the fastest way to identify and utilize some of those resources. I'm a doctor and I use Google. Saw a good quote the other day, from doctor to patient. Don't confuse my Google search with your Google search, which I think is very true, which definitely impacts on accuracy. That was the first example I could think of. For your information, for patients I recommend Patient Co UK and NHS Co UK. My doctor googled canker sores right in front of my face and spelled out CRNCER on Google as I watched in horror before he corrected his mistake. Veterinarian here. Yes, we look things up all the time. Medicine is an incredibly complicated subject, and it gets more and more complex every day as we continue to make new discoveries. No doctor, no matter how intelligent, knows everything about every condition. The difference between a medical professional and a layperson is that we have the knowledge and training to filter through the search results and identify reliable information. I am constantly asking myself questions like, does this information make sense based on what I know about the pathogenesis of this disease? That said, I rarely use Google except occasionally looking for articles on Google Scholar. The amount of terrible information out there, especially for veterinary medicine, is mind-boggling. Most of the professional veterinary organizations have websites with good information on them, and many have forums where clinicians share cases and experiences, so that's where I go first. I also keep a decent library of reference texts. At the end of the day though, I am the one who makes the final diagnosis, not the internet. Doctors look up stuff all the time, but on reputable, and often paid, databases. In the hospital where I work we use UpToDot. Not a doctor, but I have story about doctors and why they should start using online resources more. At 62 my father had tried everything to help with his insomnia. His doctor, 70, had given him all kinds of traditional sleep medicines. Nothing worked. For 20 years it was the same. Quality of life ruined. Relationships suffered. Dad's business went bust. I don't know, many times I tried to tell my dad, if you have a problem, any problem, just Google it. Eventually he realized he could research his insomnia with Google. At his next doctor's appointment he asked his lifelong doctor, "Do you think I might suffer from a lack of melatonin? I hear it's common for men in my age to have problems producing melatonin." His doctor laughed at him and said, "No. I have never heard such about anything like that." The doc said. My dad then presented him a printout of the research article he found. The doctor read it and nodded. This actually makes sense. You know what? I'm gonna put you on pill X that will increase your melatonin levels. My dad slept like a baby for the first time in 20 years. I think pre-Google doctors really need to get themselves a bit more UpToDot. I have no shame in saying that I regularly watch YouTube videos of surgical procedures before the OR. Maybe one day I'll start taping my own cases for review. But for now I find YouTube to be a good way to get in the zone and start visualizing the steps of the operation, even for routine things. Occasionally, I'll also see a different approach to a problem that I hadn't thought of. I think it's useful to get a fresh perspective like that. Family practice physician here. I tend to run into mostly the same illnesses and complaints day in and day out, but I will Google symptoms if diagnosis has ruled out the most common options. I will say, however, that for most problems that bring people to the doctor, upper respiratory infections, minor injuries, the websites are actually quite accurate. Their drawback is, of course, encouraging the hypochondriacs that they might have a rare, incurable form of cancer, a tropical disease, or super AIDS. I've seen almost all of Dr. House, the first 5 or 6 seasons of Grey's Anatomy, and I've binge watched Scrubs numerous times. Does that count? A professor told me in med school that the main aim of med school is to teach the students how to take a proper history, perform a thorough physical examination, know a few of the common ailments, and, most importantly, weigh how to look for the answers. Essentially you'll learn the basics of medicine and pick up the rest following graduation. The first month of residency is quite mind-blowing, but I just found myself going back to the basics as I was taught, and the management algorithms can be referenced somewhere. Books, internet, a senior doctor. So give me the bad news, doc. Well, after googling your symptoms it seems that you have lung cancer, herpes and gonorrhea. I went to a doctor for 6 months complaining of chest pain, relentless cough and malaise, among other blood cancer symptoms. I did Google, he knew it. He didn't take my symptoms seriously and I almost died. I was extremely close to death and his medical partner wife was scared shitless because she knew exactly what he had done, not taking me seriously. I diagnosed myself needing an ulnar nerve transposition via Google. My GP and the local hospital disagreed. I complained and moaned for 2 years in pain. Saw the consultant. Within 30 seconds he felt my elbow and said, "Oh boy, yes, I can feel your nerve slipping around, operation soon." I've found it's best to just let them to the answer you think it is. If you walk in there and say you googled it or something, they will dismiss it right away. Most times I've went to the doctor, it's something I've pretty much figured out before I got there, and they just confirm my answer and allow me to get the prescription I need to fix it. First year doctor here. Completed all of medical school. I do when sometimes I haven't heard of a certain syndrome or condition, or when patients tell me the brand name of a drug which I've never heard of yet, or often what a medical acronym in the notes mean. For the most part, we will use more reputable circumstances like UpToD to read up about pathophysiology and investigations. I would rather have a doctor Google something they didn't understand or was not up to date on, than have them stubbornly insist that their information method, which they didn't update since med school and has changed since then, is correct. Not a doctor, but had to take my son to A&E with strange bruising on his legs and pain in his knee. The doctor said the symptoms rang a bell for a condition he'd heard of but rarely seen, and he couldn't think of the name. A quick Google and he came up with the Henoch-Schönlein purpura. Urine and blood tests confirmed that this was indeed what my son had. Diagnoses are considerations, so if you put symptoms in, you get a lot of diagnoses that aren't technically wrong. We don't usually Google for diagnoses. We have an idea of what it is, then search for evidence to support so, on trusted sites like PubMed, UpToD. This usually applies when we are considering really esoteric conditions. Commonly, we do play with our phone. That's when we are keying in values to calculate scores that guide our management. For example, MedCalc. Doctors don't Google symptoms at most consumer sites like WebMD, Mayo Clinic, or Yahoo Answers, as they are terribly inaccurate and dated. When doctors Google, they go to UpToDate, a medical journal conglomerate aggregator. Think of it like a LexisNexis Orchestra of medicine, except far more up to date with citations at the end of every declarative sentence. Or they go to the specific medical specialties database, for example, oncology, NCCN website, cardiology, ACCRH website, etc. Lastly, doctors don't just look up symptoms, as symptoms are only a small part of a diagnostic picture. You look up relevant symptoms, signs, physical exam findings, special physical exam tests to perform, lab results, recommended special labs to order, imaging, geographic incidences of disease, drug-drug interactions, drug-supplement interactions, important family histories to inquire about, and less likely but critical differential diagnoses to eliminate before proceeding. Absolutely, up-to-date and current are the bomb. When I was an EMT, while en route to the hospital, I would be in the back quickly googling the condition the patient called 911 with, so that I would be certain to hit all the right tests, diagnostics, treatment, etc. I knew the info, but with all of this knowledge at our fingertips, it would be dumb to assume you know everything and not make a small effort to ensure you cover all of your bases. Not a doctor, but I work in a pharmacy. For us, it's less that we're searching on the internet, more that we have resources that you won't have at home. I work in the ER and I use the internet all the time, usually UpToD or Medscape, a procedure I have not done for 2 years. I will watch a video first to refresh myself. Someone presents with a strange symptom or physical examination finding that is tickling my brain from medical school a decade ago. I will try and scratch that itch. As someone who has to know something about everything, I spend a lot of time doing research when things don't fit a specific pattern of disease that I usually encounter. I was meeting with my doctor over winter break and we were talking about my program in college. The industry I want to go into is very social, very dependent on teamwork and collaboration, and requires you to constantly be learning, reading, designing, and thinking outside the box. The program I was in reflected that. My doctor got to thinking for a moment, then said, I really wish medical programs reflected that, and shook off the notion that all work is solo. In medicine, we don't practice like that. Your team is the nurses who check you in every time, me, and your EMDR therapist. We all work together and communicate to make sure you get the best possible care. Doctors all over the world practice like this. We get help from each other, we use Google or the internet to communicate with other medical professionals. Everything is a collaboration in medicine, especially now when medical records are digitized. Hospitals and clinic have internet, and communication is so easy. It is amazing to think about too. I've seen posts on other websites chastising doctors for googling symptoms or consulting with other doctors, but it never made sense to me. If you come to a GP and have an uncommon mix of symptoms or symptoms they haven't seen before on someone in X demographic, they'll obviously ask for help. In the same way, you Google it when you see something you've never seen before, when you fix an unfamiliar problem, etc. Since we've been toddling around in diapers, we've been told to ask for help when we need it, so why can't doctors? It's just something I've never understood. I'm just a third year medical student, but I routinely see my doctors searching these apps, not through Google of course, but through UpToDate. Yep. Use Medscape for quick references, UpToDate for more in-depth ones if I don't have my books. The difference between a normal person and a trained doctor is that we basically know what we're looking for. We can't remember everything, but it's nice to have the power to quick search. Plus those sites, even the ones mentioned here, are all summarized versions of the main books. A normal person can't look at one diagnosis and go, nah, that's impossible. Being in practice helps as well. In America, it's mostly defensive medicine, so you can do all the labs you can possibly do. In Asia, some people can't afford even the basic healthcare. Some technology is also rare, so it's very expensive. So you have to weigh what's important with the limited resources. I use Google all the time, but it definitely helps to know the names of the symptoms you're searching for, and NBSP. If you're looking for information about why a patient in the ICU is having jerking movements after receiving CPR during a cardiac arrest, you get better results for myoclonus than you do for jerking movements. Because jerking movements gets you information about seizures and movement disorders like Huntington's chorea and NBSP. Also, results containing proper medical terminology are much more likely to have been written by a credible source. Work in pharmacy and Google all sorts of stuff, often looking for journal articles. Using credible sources isn't so much about how you found them, it's more about being able to assess whether or not they're credible. IQ nurse here. Our docs Google crap all the time, especially the smart good ones. Good providers can't be afraid to admit when they don't know something and need to seek out the proper data in order to formulate a plan. Lot of great comments here. I would just add that, in my experience, we are much more likely to Google the condition and work backwards. Often, I already know what I think I am looking for, but I need to see the specific criteria off the top of my head. For example, I'm a radiologist and I do not deal with lupus enough to remember all the diagnostic criteria, but I know you need something like 5-9 signs and symptoms to make the diagnosis. So, if I had a patient ask me, I would probably pop open the UpToDate, which is really the de facto medical textbook, or find some consensus statement from the American College of Rheumatology to brush up the specific details. So I think the difference is that often we know the broad strokes of what we are looking for, we just use it to fill in the details of less familiar stuff. Being a doctor is less about having an encyclopedic knowledge of diseases, and more about being able to read a Wikipedia article and critically assess the information. Doctors Google stuff all the time. The difference between them and the patients is that a doctor can identify if something doesn't make sense, or is a big stretch. Usually I Google any of my symptoms, but I end up being told that I am probably having diabetes or some kind of cancer, so I wouldn't say it accurate, at least the ones that are favorited. I like to think that doctors have a website like Stack Overflow where they post the symptoms and what they've tried so far, and there's people who give ideas to fix it. As a doctor who literally started this week, I can say yes. I don't know anyone who would Google symptoms, but people Google uncommon diseases and double check how to treat things all the time. I'm currently about to go into med school and have worked in an emergency department in an inner city for 2 years. An interesting conversation I have with a doctor I interned with explained to me how the internet was one of the best places for confirming diagnostics. Modern medicine changes so much that what a new resident doctor learned last year in med school might be obsolete now. Clinical psychologist here. One aspect of being a clinician is to know your blind spots and to reference appropriately, aka not WebMD. When I'm googling something I don't know, it's Google Scholar or PubMed to review the relevant research, or using online versions of diagnostic tools like the DSM. The language of medicine is very different than regular language, so when a doctor uses the Googles it's different than what you're searching for. You say tiredness, I've got chest pain, with weakness, feel heart racing, breathing a mile a minute, dry cough, feeling short of breath when lying down. Doctor hears fatigue, asthenia, malaise, palpitations, potential, tachycardia, tachypnea, non-productive cough, orthony. You think, am I having a heart attack? Doctor thinks, ask more questions, consider age, young, old, very different possibilities, often, man, women. You say, why are you asking if I had pain in my calves? I told you I have chest pain. Doctor thinks, DDX, pericarditis, myocarditis, myocardial infarction, congestive heart failure, panic attack, angina, pulmonary embolism, leg pain, DVT, and so on and so forth. Google can help, but Google isn't used the same as doctors as it is by regular people. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.